If you have an interest in horses and love learning more about horses, the horse industry, teaching, or even managing your own horse business, then you're in the right place. We would love you to join us on our mission, which is to improve the lives of horses around the world through the education of riders, handlers, and trainers. So get comfortable, listen in, and enjoy.
This has been another episode sponsored by Online Horse College. If you haven't had a look at the wide variety of equine-specific accredited courses, then go to onlinehorsecollege.com and I'll see you over there. Our conversation today at Horse Chats has been brought to you by Equitana. Equitana is now celebrating 20 years of bringing Australian horse lovers everything they love, including equine entertainment, exhibition and competition. So join us on the 15th to the 18th of November in the heart of Melbourne to witness a packed program including the main event, full flight, dressage freestyle, the all-star The Way of the Horse, and Australian show jumping record attempt, which has been held for almost 39 years, as well as the best equine retail therapy with more shops than Melbourne Central. Today's guest is Dr. Raquel Butler. She's got a background as a rider in dressage and eventing, but is now a vet who's qualified in biomechanical medicine. How are you today, Raquel?
Yeah, good, thanks, Glenys. Lovely to chat to you.
Lovely to chat to you too, Raquel. I'm very interested to ask you the question about what is biomechanical medicine?
So biomechanical medicine encompasses chiropractic and osteopathic techniques and musculoskeletal rehabilitation. And it's a course that's run only for qualified veterinarians and human osteopaths and human chiropractics for treating of horses and dogs.
Good. All right, so we want to talk specifically about horses when we talk about this. But before we even start, what's your favourite quote? Tell us about how it's inspired you or influenced you with horses.
My favourite quote's actually from Albert Einstein. The only source of knowledge is experience. Horses have humbled me many times over, and my experiences have humbled me. And just when you think you know, an experience makes you realise you don't. So I think it's really important to be open-minded and to value your experiences as you learn.
And I'm sure vets are like coaches, that you get qualified. And you get qualified at almost a minimal level. Like you're qualified, you're there, you can go out and do it. But you learn so much more when you're actually out there in practice doing it.
Yeah, absolutely.
Yeah. Tell us about how you started with horses yourself. Tell us about an early memory that you would have, the particular day that you might have learned a lesson about horses.
Well, I first started on a horse when I was 1 year old. Have a photo of me sitting on my mum's old mare, and one of my first memories is riding her old mare bareback down to the paddock, and of course Mum was supposed to be leading me, but I didn't have a helmet on, and anyway, she let me go for a second. The mare started trotting back to the paddock and I fell off, and she was standing on my hair, so I couldn't get up. But she stopped and she just waited until my mum came. But I guess that was one of my kind of memories that reminded us to always wear a helmet, and I was very lucky.
Yes, but what a kind horse to just stop and wait.
Oh, yes, she just stood there, and Mum wondered why I couldn't get up, and it was because she was on my hair.
All right. Now, from there, were you always going to be a vet? Because a lot of people say that, oh, you love animals, you're going to be a vet, but not many actually get through to become a vet. When did you make that decision?
I made that decision when I was 6 years old, and that I wanted to be a vet, and I didn't know what else that I wanted to do. That was always my chosen career, and I always had an affinity with animals. And then I met Ian Bidstrup when I was already a vet, and he's the person who inspired me to I was a vet student at the time, and he inspired me to look into chiropractic and treating horses from that perspective. And I'd had very difficult horses, so that was an area that really interested me.
So when you say you had difficult horses, difficult behaviour-wise?
Yes, I had a horse that you would girth and would lay down. I had a horse that would buck and rear, and I had horses that would take off, and all of those kind of typical behavioural issues, which I now know would have been related to pain and other restrictions in their body rather than behaviour.
Mm-hmm, mm-hmm. Were they horses that you had earlier before you knew as much as you did now? You know, so you can't, too late to treat now, but just the knowledge that you could have helped them.
Yeah, absolutely. They were horses that I had growing up. And I, tried to get a few people out to fix them and help me, but I really didn't understand even the implications of things like saddle fit. So, yeah, if I had have known then what I knew now, then it would have been a very different story.
All right. Now, if someone wants to be a vet, because a lot of people, especially when they're young, they've got an affinity with animals, and all the relations go around and say, oh, you're going to be a vet because you like animals. But it takes a bit more than just liking animals, doesn't it? What else does it take to become a vet besides that affinity with animals?
Yeah, I think, in liking animals is an important part of it, but often as a vet you do have to do things that are not pleasant, such as putting them down. And I think, it's a challenging industry in the expectation level of owner, like you're dealing with the owners and the animals. So being able to have a bit of a thick skin is important, and being able to be kind of realistic in what you can and can't do to help the animals, and not kind of feel like it's always your responsibility of what happens to that animal, because it's often down to the owner's choices and sometimes money and things as well. So it can be quite a challenging career with after hours. And I think the most important thing is, if you do become a vet, to get a very supportive boss.
Okay, good. What do you think is the best thing about being a vet?
I would say the options that it gives you. So It gives you many options to be able to kind of go into different areas, and it's certainly given me the options to end up now teaching at a university. So without having that veterinary qualification, I wouldn't have gained the knowledge that has allowed me to be in this position. So I think it gives you many kind of options and variations within even being a vet as well.
Okay. Now, within this biomechanical medicine, how do you think, if you've got like a case study that you'd like to say that you've helped a horse, or, something that you can give us some examples of?
I've dealt with quite a few horses with behavioural issues that people haven't been able to figure out, and they have generally kind of come down to underlying pain issues. And so working with the horse's body and with them and trying to figure out where in the body their problems are. Probably one of my things is even with my own horse. So he's an ex-racehorse who was extremely difficult when I got him, and he would kick and bite and become very kind of emotional, and being able to kind of help him physically and emotionally to become calm and relaxed and think through his reactions has been extremely rewarding, and to develop that relationship with him.
All right. Now, you talked about Dr. Ian Bedstrop, who's influenced you, but what about horses who've influenced you? Have you had your own individual horse, or was that the one then?
Yep. So, Henry has been a big kind of influence in my life, because he's probably taught me the most, but I've had a lot of difficult horses, so that's probably been the biggest influence, that have, still tried their hardest and done their best, even with their underlying issues. So each one of those has kind of motivated me to go down this path. And a special horse was Jack, and I trained him from off the track up to doing, half pass and jumping. And he was a very beautiful horse, and I unfortunately had to sell him to go overseas. But he became a head shaker, and even with that, he still tried his heart out. So he's probably a big one that I kind of commit everything to, because we could never quite figure out where and why he was head shaking at the time, and I could definitely have helped him now.
Okay, what do you think it was?
He reacted to allergies and pollens, but I have suspicions that it originally came from a hind end, which is not a common way of thinking about head shaking. But being an ex-racehorse, he definitely had hind end weaknesses. So I think potentially that's where it stemmed from when I look back at all the little signs that added up.
Okay. What do you think's been your proudest moment then?
My proudest moment would be the moment that I rode my recent horse, Henry, bareback and bitless. And to be able to get such an emotionally charged horse that I was told was dangerous, and to basically get rid of him, to be able to kind of get to that moment and have him responding to me and doing as I asked him to do was a very proud moment.
Mm-hmm. Thinking about, this is, talking about the biomechanical medicine again, what do you think is the biggest challenge in treating horses within that whole biomechanical medicine? If you see a horse with a problem, and you want to treat them, what's been the biggest challenge?
One of the biggest challenges is realising, so I've also done quite a few horse dissections with Sharon May Davis, and one of the biggest challenges is knowing what could potentially be on the inside when you're trying to treat things from the outside. Mm-hmm. And having seen what is on the inside, often it's a lot more complex than what we could ever have realised. So I think that has been a big challenge for me, to recognise that you can't fix everything, because sometimes the underlying trauma is too severe, so it's always working within those limitations. Mm-hmm. And the other challenge is getting owners to recognise their commitment, but also the importance of things like saddle fit and hoof balance, and even the way that they're being ridden, and how those things are going to have a massive impact on the way that they respond to a treatment.
Okay. So with the owners, you're saying to get the owners to do their part. Do you get owners who say, look, I'm just not interested, I just want to ride my horse, who are a little bit, I suppose, old school as far as the holistic approach goes? Yep,
I certainly had those owners, and they usually didn't end up staying as my clients. Mm-hmm. The clients that I did have were very committed to their horses and did kind of do the exercises and do the best that they could do for their horse, so they saw great results because of that. Usually, I would tell people, if they kind of weren't willing to have a little bit of time off the horse or put in a bit of commitment with the exercises, then they were probably not going to get the most out of the money that they spent for me to treat their horse. So, and that was not a problem for me, because I worked with the ones that did.
Yes, you've got your own select group, which is good.
Yeah.
All right. Now, just thinking about a common fault that you might see across the board. If you go into a new area, see new people, what's a common fault that they've got with their horses?
I actually think it comes back to riding and our underlying vision of a horse in correct balance and posture. So I think a common problem is that horses are not kind of well developed through their back and utilising their core and in self-carriage adequately. So I think that our image of what self-carriage is needs to be altered, and true kind of self-carriage, they're really lifting up through their back, they're engaging their core, and they're reaching up and out with their nose and their poll, and definitely in front of the vertical. So I think that that's quite a common fault, and that we're hopping on them just too early and that they're not kind of developed and supportive enough through their body to support us in the saddle.
Okay. So if you've got someone, if you go to treat their horse and you can see this is a problem, what do you normally tell them? What advice do you get? Do you ask them to get a specialist coach to help them, or what advice?
Yeah, like the number one thing would make sure that their saddle was fitting, because otherwise you can't ride them appropriately if your saddle's not fitting. So we'd start with that, so getting a qualified saddle fitter to assess their saddle fit and make sure that wasn't an issue. And then I would show them a few little tips, so groundwork tips and rehab kind of exercises to help as well. And then, usually I would have a coach that I could refer them to who was working along the lines that I was that I wanted them to understand.
Okay. And then, have you got any books that you'd recommend? Just something that's going to complement the work that you do with them?
Yeah, actually, the book that I would recommend is actually to go to a dissection with Sharon May Davis. I don't think anything
She hasn't written any books, has she?
No, she hasn't written any books, but to just go to a dissection and get a dissection manual. But Atlas of the Equine Musculoskeletal System by Dr. Ivana Roddick-Land is also a great kind of pictorial anatomy textbook that gives you a greater understanding of the horse's inside.
Okay. And it's easy to say go to a dissection, but she's a little hard to get into.
Yeah, she is.
To book into. She only has very restricted numbers.
Yeah.
And remember, you can find all the books recommended by our guests at horsechats.com/books. You can have a look at the guest page for the individual book they recommended, or just look at the recommended books by order of popularity at horsechats.com/books.
What are you looking forward to at the moment? It says you've got something coming up.
Yep. Looking forward to doing some research at CSU with some rehab and anatomy. And I'm also, looking forward to speaking at Equitana as well on that equine stifle and biomechanical assessment from the hyoid to the hoof. So I'm really looking forward to that. I think it's going to be a great exhibition this year.
I had to go and have a look where the hyoid was. So if you'd like to explain the hyoid to the hoof and why you've chosen that.
Yep. So the hyoid is a group of bones up in under the jaw, and it supports the tongue. It also supports the upper airway, and it's an area that I have great interest in and will hopefully pursue with research one day, because it has so many connections, both anatomical and fascial connections to the rest of the body. So there's direct connection to the stifle, for example. And, as a lot of therapists believe that the hyoid is kind of a mirror of what's going on within the horse's body. So to be able to kind of show those connections through research would be extremely rewarding. The hyoid also connects up into the bottom of the ear, and but it's able to go through kind of a three-dimensional range of motion as well. So, I think it's a really important area. A lot of therapists really assess that area and treat that area quite a lot, and it's just quite astounding the connections all the way through the horse and how treating that area can alter the hind end of the horse.
Okay, good. Now, if you're going to sum up your philosophy just into a lesson or into a message for our listeners, what would you say?
One of the biggest things I'd say is always listen to your horse.
Okay.
So they might not have a voice, but they will communicate with you in many ways if you just kind of see them and ask them and value their opinions, which might not always be what you want to hear. But if you think that your horse has something going on or something wrong and people are telling you otherwise, trust your own judgment as well, because so far I've never met an owner that's been wrong in that way.
All right. Now, Raquel, how can people contact you? What's the best way?
I have a Facebook page, Integrated Veterinary Therapeutics, and so that's probably the easiest way.
All right, and those details will be on our page as well at horsechats.com/Raquel Butler.
Yep.
And all the details about the Facebook page and the other contact details, you can get hold of us if you just have a look at that website and that link. Is there a phone number, or that's all on the page as well, is it?
My phone number is 0435 813 505.
Yep.
But, obviously my integrated veterinary therapeutics is separate from my work at
Sure.
CSU, so that's my full-time job at the moment, so just so that people, recognise that.
No worries at all. All right, great to talk to you, and I'm sure we'd like to get you back sometime soon, especially talking about from the hyoid to the hoof, because, you only talk for a couple of minutes on that, but I'm sure that there's a lot more information you'll be able to give us about that.
Yeah, absolutely. No, thank you very much.
Okay, thanks, Raquel. Good to talk to you. Bye-bye.
Thanks, Glenys. Bye.
Now, if you're still there,